Hey everyone, I know it's been a little while since I've checked in with everybody, so I wanted to make a quick video and give you the latest updates. Last time I had told you that we were looking for a date for brain surgery, and we got that date, but we also had to check the status of my heart before finding out if we could go forward with surgery. And so I'm happy to say that we got some test results this past week on the echocardiogram that I had and the stress test. And the lady sent me those results, it was Friday morning, and then she called me and she said, "Scott, I just want to let you know that both of those results came back normal." And I said, "Well, that is awesome news." I said, "This is the first time that I've ever been called normal before." And so I said, "I'll make sure I'll tell my wife. She'll be extremely excited." So that was really good news. That hopefully leads everything to go as a go for surgery in December. At this point, December 9th is our scheduled surgery date for the removal of the tumor. The 8th would be, prep for surgery. We will probably go out there a couple of days before that just to make it a little trip for Laura and I. And then, of course, we'll also be out there really 8 days after surgery, including the 2 days in the hospital. So anyway, we're going to be out there for quite a while, almost 2 weeks. But I appreciate everyone praying for the heart results and that those were normal. I know a lot of you will come up to me and say, "Hey, I'm praying for you every day. You're on my prayer list." And I really cherish those prayers. Excited now about looking forward to surgery here in December. And I know it's going to pass by pretty quickly. As soon as we got the results on Friday back, we went ahead and purchased plane tickets, got the rental car scheduled. So a lot of this stuff is done. We'll still need to make some arrangements for lodging and those type of things depending on where we are. But looking forward to hopefully a successful surgery. I would just ask you to pray for, specifically the facial nerve, as I've mentioned that before. Where this brain tumor is located is on the acoustic nerve, which they're going to be taking completely out of my right ear. But there's also the vestibular nerve, which is more of your balance nerve, helps you with your equilibrium. They'll be taking that out. And then also the facial nerve is a part of that bundle. And they really have to be very, very careful with that to make sure it's not cut. And in fact, they might leave a little bit of the tumor on there just to preserve that facial nerve. And so, sometimes they're able to get the whole tumor. Other times they just have to leave a little bit to try to protect the facial nerve. So we're just praying that, God knows exactly what's going to happen. And the other thing I guess I'm apprehensive about, if you want to use that word, is the facial nerve. Even if they protect that, you still can have some facial droopingness, I guess you would say. Some of that can be temporary. Other of that can be permanent. And so, it's going to be kind of hard to look yourself in the mirror and not being able to smile maybe like you would before for a period of time. And so that's more of a mental thing, I think, that I'll have to face along with the physical part of it. But I appreciate your prayers. If you're going to pray for anything, just pray they're able to get as much of the tumor as they can, and also that the facial nerve will remain intact and that I won't have too much facial interruption with that. So again, thank you so much. I'll keep you updated as we get closer to December, and we'll kind of keep you updated in California as we go forward with surgery. Thank you.